Welcome to UMCC Medical Consultants, where your health matters to us. What are the common problems that mucolytics can solve, you might ask? Well, mucolytics are the unsung heroes in the world of respiratory health. Their primary role is to break down mucus, easing breathing for many. They are particularly beneficial in managing a range of respiratory conditions. Think about chronic bronchitis, asthma, cystic fibrosis, and more. These conditions often involve thickened mucus, and that's where mucolytics step in. Understanding the action of mucolytics can help us appreciate their role in managing these conditions. Let's dive into some common examples of mucolytics and their uses. First off, we have acetylcysteine, a robust mucolytic that works by breaking down mucus in the airways. This makes it easier for patients to cough up the mucus and breathe more comfortably. Next up is carbocysteine. Like acetylcysteine, it works by altering the mucus in the airways, making it less thick and sticky, hence easier to cough up. Now, where would these drugs come in handy? Well, they are particularly useful in managing respiratory conditions characterized by excessive or thickened mucus. Conditions like chronic obstructive pulmonary disease, also known as COPD, cystic fibrosis, and bronchiectasis are prime examples. In fact, these mucolytics play a crucial role in the treatment regimen of these conditions. By reducing the thickness of the mucus, they not only ease symptoms but also prevent further complications. These drugs, while common, have a significant impact on the lives of those suffering from respiratory conditions. So, how do these drugs work within our bodies? Mucolytics, as their name suggests, have a unique ability to break down mucus, making it less viscous and easier to expel from the body. They achieve this by disrupting the chemical structure of mucus, specifically targeting disulfide bonds that hold mucus molecules together. The result? A thinner, less sticky substance that can be coughed up with ease. Now let's talk about absorption. Once ingested, mucolytics are rapidly absorbed into the bloodstream from the gastrointestinal tract, making their way to the respiratory system where they get to work. As for metabolism, it primarily occurs in the liver, where the drugs are broken down into metabolites. These metabolites are then excreted through the kidneys, leaving the body via urine. And there you have it. From ingestion to excretion, these processes underline how mucolytics alleviate respiratory symptoms and improve patient quality of life. But how do mucolytics interact with other drugs and our body over time? Let's dive into the fascinating world of pharmacodynamics and pharmacokinetics of mucolytics. Pharmacodynamics refers to what the drug does to the body, while pharmacokinetics is about what the body does to the drug. Mucolytics, as we've discussed, work by breaking down the structure of mucus in the airways, making it easier to cough up. In terms of pharmacokinetics, mucolytics are generally well absorbed into the body, metabolized by the liver, and excreted in urine. But what happens when they meet other drugs in the body? Well, mucolytics can interact with other medications, altering their effects. For instance, combining mucolytics with cough suppressants could counteract their effect, making it harder to cough up loosened mucus. These interactions are complex and can have significant implications, potentially impacting the effectiveness of treatment or causing unexpected side effects. Therefore, understanding these interactions is crucial for safe and effective use of mucolytics. Like all drugs, mucolytics come with potential side effects and adverse reactions. Some individuals might experience mild gastrointestinal issues such as nausea, vomiting, or diarrhea, while others could face more severe reactions like rash or hypersensitivity. It's also worth noting that these medications can sometimes trigger bronchospasm, particularly in individuals with asthmatic conditions. When considering the use of mucolytics during pregnancy, it's crucial to weigh the benefits against potential risks. Although these drugs are generally considered safe for use, it's always best to consult with a healthcare provider. Further interactions are also a key consideration. Mucolytics may interact differently when combined with certain foods, alcohol, or other medications. For instance, alcohol can intensify some side effects, while certain foods could alter the drug's effectiveness. Moreover, other medications might interact negatively with mucolytics. So it's important to provide your healthcare provider with a comprehensive list of all medications you're currently taking, including over-the-counter drugs and dietary supplements. Being aware of these factors allows for informed decisions and safer use of mucolytics. To wrap it up, mucolytics are a vital tool in managing respiratory conditions. They work to break down mucus, aiding in its expulsion. From the dynamic processes of absorption and metabolism to the intricate balances of pharmacodynamics and pharmacokinetics, these drugs are truly remarkable. Equally important to note are their potential side effects, adverse reactions, and interactions, especially in pregnancy. Understanding the complexities of these drugs allows us to better appreciate their role in respiratory medicine and ensures their safe and effective use. UMCC, your ultimate medical consultant connectors.